Welcome back to Everyday Health Stories, the podcast where we explore the fascinating world of medical science through the power of storytelling. I'm your host, Anna, and today we're diving into something that, well, affects so many of us: chest pain. You know, it's one of those symptoms that can really make anyone nervous. And that's exactly why we're here today. We're going to help you understand the differences between chest pain that needs urgent medical attention and discomfort that can probably wait for a checkup. And I'm absolutely thrilled to have my good friend and brilliant medical expert, Dr. Kota Reddy, with us today. Hey, Dr. Reddy.
Hey, Anna. It's great to be here, like always. You know, chest pain is something people totally worry about, and learning how to recognize different types can make such a huge difference. I'm really excited to dive in and help our listeners understand when they need to act fast and when they can take their time.
Before we jump in, take a moment to hit pause and subscribe to the podcast. You'll get notified of new episodes, gain access to exclusive content, and join a community that's making positive changes, one story at a time. Let's start with heart-related chest pain because that's usually the big concern that everyone has. So, Dr. Reddy, what are those key signs that we really need to watch out for?
Oh, this is super important, Anna. You know, the main thing to look out for is this sensation of pressure or heaviness in the chest. Like, imagine someone sitting on your chest, or like a tight squeezing feeling.
That sounds really scary.
It definitely can be. And here's what makes it even more crucial to recognize: this pain doesn't just stay in the chest. It can, spread out to your arms, neck, jaw, and even your back. And when it comes with other symptoms like shortness of breath, feeling nauseous, breaking out in a cold sweat, or feeling lightheaded, that's when you absolutely need to pay attention.
Oh, wow. And I've heard it can happen during certain activities too?
Exactly. That's actually a really important point. Like, if you notice this pain showing up when you're doing something physical, maybe climbing stairs or even just walking around, and it doesn't go away when you rest, that's a huge red flag.
So what should our listeners do if they experience these symptoms?
Listen, there's no two ways about this. If you're experiencing these symptoms, you need to get emergency medical care right away. Don't wait. Don't try to tough it out. Because when it comes to heart attacks, time is absolutely critical. Every minute counts.
So, Dr. Reddy, what about when someone gets that burning feeling in their chest right after eating? That's pretty different from what you just described, right?
Oh yeah, totally different. You know that burning sensation you're talking about? That's usually what we call GERD, or gastroesophageal reflux disease. Most people know it as heartburn, which is honestly kind of a confusing name since it's not actually related to the heart at all.
How can people tell the difference between that and actual heart problems?
So, there are some really distinctive features here. Like with GERD, you'll often get this burning sensation that starts right here in your chest, and sometimes you might get this really unpleasant, like sour taste in your mouth. And what's really interesting is the timing of it all.
What do you mean by the timing?
Well, you'll notice that GERD typically flares up after meals, or, when you're lying down or bending over. It's completely different from heart-related pain because it's not triggered by physical activity. And here's something really helpful to know. If you take antacids and the pain gets better, that's usually a pretty good sign it's coming from your stomach, not your heart.
Oh, that's such a useful tip. And what kinds of foods usually trigger this?
The usual suspects are things like spicy foods, citrus, coffee, the good stuff. But it can also be triggered by eating large meals or lying down too soon after eating. And sometimes even things like chocolate or wine can set it off. Everyone's triggers are a bit different.
Dr. Reddy, I've been wondering about something. What about those times when moving around makes your chest hurt? Like when you can actually point to exactly where it hurts?
Oh, yes. That's actually something I see quite often in my practice. And it's really interesting because this kind of pain is usually what we call musculoskeletal pain. It's completely different from heart problems.
How so? Like, what should people look out for?
Well, the key thing here is that it's usually sharp, kind of like a stabbing sensation, and this is really important, you can typically pinpoint exactly where it hurts. Like, if you press on the spot, it'll hurt more, which isn't something you get with heart pain.
That makes so much sense. What usually causes this type of pain?
Oh, all sorts of things. Sometimes it's from overdoing it at the gym or moving furniture, or even something as simple as having a really bad coughing fit. The pain tends to get worse when you move in certain ways or take deep breaths.
And this is totally different from heart-related pain, right?
Absolutely. See, heart pain is usually more like a diffuse pressure or squeezing sensation, but with musculoskeletal pain, it's very localized and you can usually trace it back to some kind of physical activity or strain. Plus, and this is really key, it typically changes with your body position or movement, while heart pain usually doesn't.
You know what's also really fascinating and honestly kind of scary sometimes? The way anxiety can actually cause real physical chest pain. I've had listeners write in about this exact thing.
Oh, yes, absolutely. And you're so right about it being scary. The thing is, anxiety related chest pain is incredibly common and it can feel really intense, Like sometimes people come into the ER totally convinced they're having a heart attack.
That must be terrifying. What exactly does it feel like?
Well, it's interesting because the chest pain often comes with this whole cascade of other symptoms. You might feel your heart racing, like really racing, and you start breathing faster. Some people get super sweaty, dizzy, and there's often this overwhelming feeling of, well, doom is the best way to describe it.
Oh, wow. That sounds intense. How can someone tell if it's anxiety and not something more serious?
The key difference is usually in how it starts and how it plays out. See, anxiety-related chest pain tends to come on really suddenly, often during stressful situations. And here's the interesting part. It usually gets better once the person starts to calm down or their anxiety passes.
But I'm guessing you don't want people just assuming it's anxiety, right?
Yes, look, if you're not totally sure what's causing your chest pain, it's always better to get it checked out. Because you know what? The symptoms of anxiety can actually mirror those of a heart attack pretty closely. Better safe than sorry, right?
That's such important advice. What about people who deal with this regularly?
Well, for those folks, working with their doctor to develop a management plan is super important. And, learning some breathing techniques or other anxiety management strategies can make a huge difference. We're seeing really good results with things like mindfulness and cognitive behavioral therapy.
Now, let's talk about something that I think a lot of people might not think about right away. Chest pain that comes from our lungs. Things like blood clots or pneumonia.
Oh, yes, absolutely. And this is really important to talk about because lung-related chest pain can be quite serious. Like when we're dealing with something like a pulmonary embolism, that's a blood clot in the lungs. It can be really intense.
What should people be looking out for specifically?
Well, the pain is usually pretty distinct. It's typically this sharp stabbing sensation that gets a whole lot worse when you try to take a deep breath. And here's the thing, it often comes with other symptoms too. You might notice you're breathing faster than normal, your heart's racing, and sometimes people even cough up blood, which is definitely a red flag.
Oh, wow, that sounds really serious. What about pneumonia? Does that feel different?
Yeah, so with pneumonia, you'll often get this kind of sharp chest pain too, but it usually comes with a fever, sometimes a pretty high one. And you might have this cough that just won't quit. Plus, you might feel just completely wiped out, like you've been hit by a truck.
That's really helpful to know. So when should someone absolutely not wait to get help?
Look, if you're experiencing any sudden severe chest pain, especially if it's making it hard to breathe, that's an emergency. And if you're getting symptoms like coughing up blood, severe shortness of breath, or you feel like you might pass out, don't wait around. These could be signs of something really serious, and time can be super critical in these situations.
So basically, if in doubt, get it checked out?
Exactly. I always tell my patients, trust your instincts. Your body's pretty good at letting you know when something's seriously wrong. Better to have it checked and be told it's nothing than to ignore something potentially dangerous.
Wow, we've covered so much ground today. I think it would be really helpful if we could kind of wrap everything up for our listeners. Dr. Reddy, could you give us like a quick rundown of the most important takeaways?
Of course. Look, the key thing to remember is that heavy chest pressure, especially if it spreads to your arms or jaw and comes with shortness of breath, that's when you need to act fast, like really fast. Don't wait around thinking it'll pass.
And what about those other types we discussed?
Right. So if you're getting this burning sensation after eating, that's probably your stomach talking. Classic acid reflux. And if it's more of a sharp pain that gets worse when you move or touch it, that's likely muscle related.
Oh, And before we wrap up, I really need to remind our amazing listeners about something important. Take a moment to hit pause and subscribe to our podcast. You'll get notified of new episodes, gain access to exclusive content, and join a community that's making positive changes one story at a time.
Absolutely. And you know what? I just want to add one final thing. If you're ever unsure about chest pain, don't try to diagnose yourself. Better safe than sorry, right? Your health is just too important to take chances with.
That's such great advice. And we should probably mention that this podcast is for informational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider for any medical concerns.
Couldn't agree more. Thanks for having this important conversation, Anna.
Thank you, Dr. Reddy, for sharing your expertise with us today. And thanks to all our wonderful listeners for tuning in to another episode of Everyday Health Stories. Until next time, stay healthy, stay informed, and don't forget to listen to your body.